We'll now begin to talk about some of the echocardiography in various types of congenital defects. We'll begin with the congenital shunts, and first a few opening thoughts about some of these defects. Well, how do some of these patients make it into adulthood? And I think there are probably three choices for that. This isn't a question for you. Either these defects are silent, or they're relatively asymptomatic, or the patients have just been lucky and probably also avoided medical care. If you encounter an adult patient with congenital heart disease, they're likely to be in the latter two categories, or excuse me, in the first two categories. Defects which allow survivability, I put down about 10 or 12 defects here, and just looked at their relative survivability without doing anything in this graphic presentation, and then looked a little bit at some of the other features of those defects. And I think what you see is that defects such as ASD, partial anomalous pulmonary veins, bicuspid aortic valve, have a very high survivability issue. And in general, as you look at symptoms, obviously those that have high survivability have fairly low or absent symptoms, and those that have a lower survivability generally have a fairly high degree of symptoms. Murmur, interestingly, isn't a great determinant. You can have defects which have a fairly loud murmur and yet have very high survivability. So evaluations for heart murmur may or may not be helpful in determining what the defect is just by the indication. Cyanosis, however, certainly those cyanotic lesions, those that have a fair amount of cyanosis, are going to be in the low survivability range. Patients with cyanotic defects are, generally speaking, not going to do quite as well. Well, I mentioned this before when we started this lecture series. I want to emphasize it again. When you're doing these examinations, you need to get a history. And history, in many cases, should include old records. Our feeling is that echo can be everything. It can answer all the questions that we need to answer for many of these patients. However, you have to know what you're looking at. And that's what we're about to embark on, is giving you the tools to look at some of these echoes and understand